Hi there. Welcome to In the Clinic Before and Afters. I'm Dr. David Jack and I'm a cosmetic doctor working in London. In this episode we'll meet Nicola, who's a mum in her 40s and she just wants a bit of a boost.
My name is Nicola and I am 46. I've just recently finished a very hard-working position, working with children, very tiring, and I'm going to go into something new now. This is my me time, so I have some trepidation. I am a little nervous, but I'm sure I'll be in good hands.
So Nicola, you've done any treatments before, or is this the first time that you're looking for anything like this?
No, I've never had anything done before.
Okay, and why now? What's changed that's made you...
Well, I've just come out of a very stressful job working with children in a nursery.
Sure.
Just to look a little fresher, and the lines in my forehead,
Sure.
I think they could be plumped up a little bit.
Sure, yeah.
And some of the lines at the side,
Okay.
where it's dropped down slightly.
Okay, yeah, sure. So my approach is always to do things in a very kind of understated way, and I think that probably for these areas here, the best thing to do would be a little bit of Botox to start off with. I would suggest a little bit just to lift the eyebrows from the side, so you're getting just relaxation here, relaxation there, to open the eyes up a bit, and I think that will just give you a nice kind of rejuvenated look without looking overdone or anything.
Quite a natural look.
Yeah, totally, which is always the way to do these things. So Botox works by relaxing muscles, so it blocks the nerve impulse to the muscle, telling it to move whenever your brain says to frown or to screw your eyes up. And by blocking that, you relax the muscle tension on the skin where it's inserting and creating the lines. So over a period of about 2 weeks, the Botox just starts to relax the muscle, relaxes the muscle tension, and gives the skin a chance to just kind of renew itself without the lines there. So you notice the lines just smoothing out. It should never be done so that the muscle is completely paralysed. You should still have plenty of movement there, that you're able to express yourself in a very normal, natural way, so that people shouldn't be able to tell that you've had anything done.
That's always my fear, that I would have a face that doesn't move.
Doesn't move, yeah, and I think that's a lot of people have that fear that come to see me. They've heard the horror stories about Botox. So really important that you still maintain movement, so that you don't look like you've kind of had your face French polished. The other thing that I'd maybe suggest is just in this area here, you're starting to see some of the effects of a little bit of volume loss just on the surface of the cheekbone. Do a tiny bit of filler up there will also help with some of the lines that you're starting to develop around the eyes. And I'm talking really minimal here, so just probably 1 syringe of filler, but it would just give you a little bit of a lift there and increase the effects of the Botox. So we can do both of those things if you're up for it. Fillers work in a slightly different way. That's about replacing volume where it's been lost, and as I said, lost a wee bit of volume around about this area, just from bone, which happens to everybody as they age, and then that allows the fat pads here to start slipping down a wee bit. And by replacing a bit of the volume there, you just improve the surface of the skin there. So just a bit like reinflating things and giving a bit more support to the muscle from underneath. It just relaxes everything even more. And what happens is over a period of about 12 months, your body will just break down the filler. Very low risk generally, but always with any injectable, including Botox, there's a tiny risk of bruising, tiny risk of swelling, tiny risk of lumpiness as well, but the risk of that is really just for the first 5 days or so, and you can usually get rid of it by massage. And the only sort of major risk of filler, but it's something that we hardly ever see, is injection into a blood vessel and skin damage secondary to that. If that were to happen, the filler has to be broken down, but super low risk of that happening. And also the technique that I'm going to use is injecting onto the surface of the bone, so you're well away from any blood vessels, so it's a really safe way of doing it. So I wouldn't say that that's a high risk by any means. So what I'm going to do to start with, I'll just pop on a wee bit of numbing cream just to kind of take the edge off the injections, because it is needles that's being used, but you really shouldn't feel that much. It's relatively not completely painless, but relatively comfortable, I would say. All right.
Okay. So after I've had the treatment, I have to go and pick my children up from school. Is there anything that I need to know that I should or shouldn't do?
Main thing I would say is not to lie flat for the next hour, which I presume you're not going to be doing anyway if you're picking your kids up. Try not to touch the area, so particularly the hands carry a lot of bacteria, so we don't want to get any bacteria underneath the skin. But as long as you don't touch, don't put makeup on for the first hour or so after the treatment, you should be absolutely fine.
I'm hoping that this treatment will give me more confidence as I'm stepping into something new, a new career, you see.
Yeah, okay, great. So Nicola is fairly typical of the patients that I see in my clinic that are just starting to see some of the changes associated with the ageing process, volume loss, very fine lines and wrinkles. I wanted with Nicola to start off very gently, just doing a little bit of Botox just to relax some of the lines that she was complaining about, and then a tiny bit of filler just to revolumize where some volume has been lost. Using a really minimal technique, injecting right onto the bone surface so it's nice and safe, and also providing really minimal downtime as well.
The one thing I've always been a little scared about is having a procedure done that is instantly recognisable, something that has altered my face in some way. The thing I like from looking at Dr. Jack's videos and other things online is it's a very natural approach. It looks quite understated and it's hard to tell that the procedure's been done.
Well done, that's all the injections done. Super easy, and it's just replacing a wee bit of the volume there that's been lost. So it might feel a wee bit kind of achy for today in the cheeks, but take a couple of days for it just to blend into your skin, and then it'll gain a little bit of volume over the next couple of days, and then just fill out these areas here just to lift ever so slightly and support this area from underneath. All done.
Thank you.
Cool.
Well, I was surprised it was over so quickly. It was minimal pain. I could feel the needle go in, but after that, very little. I'm feeling really positive. I'm really impressed at how efficient it all is. Can't wait to see how I'm going to look in over the next few weeks. Yes, I hope to feel completely refreshed and rejuvenated.
Hi Nicola, lovely to see you again. How are you?
I'm okay, how are you? After the initial consultation and the Botox and filler, it's given me more confidence to move forward with maybe a few other little tweaks here and there. I've never been very happy with my chin, so I wondered if he could do something with this section of chin here. Also, the lines around my mouth, I was going to have a little chat with Dr. Jack and see if he can do anything about that as well.
We did some Botox and fillers last time. That all, you were quite happy with that?
I was very happy,
okay,
yeah.
Good, yeah. So tell me what's kind of still bothering you, and if there's anything else that you were...
Well, if I may, I'd like to have something done with this chin,
the chin
here.
Yeah, okay,
yeah,
sure.
It's just tightened, I think.
Okay.
Also, there's the lines here.
Okay,
If you could do anything small there.
Okay, that's fine, yeah. So put some filler here last time to try to address the slight loss of volume in the cheek area. So I think the next stage of that would be to put some filler actually into the lines themselves.
Okay.
And we can do just a little bit there to soften the lines. They won't go completely, but just to reduce the depth of them. And then for under the chin, I think what we should do is a resurfacing treatment called Morpheus 8, which works by creating injuries on the skin surface and also breaking down some of the fat under the chin. And it's a fairly straightforward treatment. It's called a thing called fractional radiofrequency. So these injuries that are created allow pins to enter under the skin and then heat the fat. And what that does is it kills off some of the fat cells and also tightens the area at the same time, so you get a bit of lifting and you get the reduction in volume at the same time. It's about a couple of days of downtime with it, usually not very intense, maybe a little bit red today, might be a little bit swollen tomorrow, but you can cover it up with some mineral makeup if you want to, and just go about your business as normal. But fairly quick treatment. Pop some numbing cream on for an hour just now, and then we'll do the treatment once it's completely numb. And we can put some filler in there as well. Maybe put a wee tiny bit more Botox in there. We're still seeing some of the lines there, just to top that up. And yeah.
How long would the chin treatment last for?
So the treatment on the chin is a permanent thing. So you get a permanent reduction in the fat there, and also permanent thickening of the dermis, which is a supportive layer of the skin. You tend to find that the skin loses collagen and elastin over time, so it might be a treatment that you'd want to repeat in a couple of years' time, but it's not something that needs to be repeated very frequently. Do 2 sessions though, now and then maybe in about a month's time, just to kind of top that up and keep the stimulation going, but it is a sort of permanent thing. So, yeah.
How often would I have to do, you mentioned
Botox.
that I would have to have a little bit more.
So this is just kind of top up what you did, but generally speaking Botox would be done every sort of 4 months roughly, so about 3 times a year, just to kind of maintain things. So Nicola wants to lift her chin, which is a family trait that she has, where the chin is slightly fuller, so she wants to lift that a little and reduce some of the fat under the chin. And probably the best way to do that is using Morpheus 8, which is a fractional radiofrequency device that can both tighten skin and reduce fat at the same time. So small pockets of fat that are just under the skin, it can break this down. So we'll do that for her, do 2 sessions and see how she gets on with that. Hopefully we'll just give her a nice lift and tighten of the jawline, just to give a bit more definition. And I'll top up the Botox. She still had a little bit of a line there, so just adding a little bit extra there won't do any harm. It'll just kind of finish off the results very nicely, I think.
With the Morpheus here, you feel a burning sensation and the scratch of the needle. But after the initial shock, you kind of get used to the feeling, and when it's completed, the pain goes away. I'm feeling great actually. It's really subtle, and it's just really giving me a lift. It's making me feel just a little bit perkier, taking out some of the lines, the line in my forehead, the darkness under the eyes. It's feeling great. I do think it's made a difference, and it's definitely given me a bit of a fresher appearance. In turn, it has boosted my confidence, and I feel a little bit more confident now to just walk in and into a job interview. It's a really positive change. I think Dr. David Jack's been extremely professional and patient, and he has explained everything along the way. He's been really honest, I feel, about any potential discomfort. It's been a really good experience from beginning to end.
So if you enjoyed watching this today, then please subscribe to my channel, set the alerts bell for new videos, and leave any comments or queries that you want me to answer, and I'll try to get back to you as soon as I can.